The Registered Nurse Safe Staffing Act of 2015 was essentially created to provide protection to the patient by creating staffing levels at the hospital. The patient-to-nurse ratio is the number of patients to a single nurse. This could be anywhere from 6 patients to 8 patients, depending on the floor and the type of care that is needed per nurse per patient. Having the Safe Staffing Act helps to ensure that the patient is receiving the best quality of care that can be given by the nurse. This allows for less complications and less readmission back to the hospital. Before the Safe Staffing Act was passed, the nursing staff at hospitals were overwhelmed with the amount of patients that they were required to care for in a single shift, which led to nurses becoming stressed and burnt out. This was leading to their own personal health issues such as anxiety, depression, heart disease, and hypertension. This was causing both a lack of patient and staffing care, with mistakes taking place. By having nurses under crippling amounts of stress was leading some to have negative outcomes. Some negative impacts can consist of missed medications, lack of compassion, and even sometimes neglect without even being noticed. Before the Safe Staffing Act was passed, this statement here was actually true. The safety of our patients is our number one priority. The Safe Staffing Act ensures that the nurse is caring for a patient that is within their scope of practice. This ensures that the patient is getting the best care possible from someone that is qualified to handle their needs and have the level of experience to ensure the best possible outcome. Overall, it is important to remember that these safety ratios are important in order to guarantee the safety and care for all parties involved. This means both the patient and staff, so that neither will be placed in harm's way, which could result in a tragic circumstance.